Hi guys, this is Dr. Cheryl Schmidt from Vital Chiropractic. Thank you for joining us today on this Talk and Tea. I got my tea here today. I have today with me a midwife, and I know some people don't even know what a midwife is. So, which is kind of crazy to me because I'm in the circle, I guess, of more holistic people. So I know exactly what a midwife is and what they do. And I've had 4 midwives for all 4 of my children. So I want to introduce you to what midwifery care is all about, what it is, what they do, dispel any myths that you might have about what midwives do. And I'm happy to have Allie here as our midwife to share with us what she does, how she got started, how she got into this business of midwifery. I'm going to tell you a little bit about her before we get started and ask her all of your questions. And feel free at any time, if you put in a question in the comments, I'll see it and we can ask Allie along the way. So if you have questions, you can ask her too. So Allie is a native to South Bellingham. She's just north of me here. And she has felt elated to serve her community that she grew up in. She actually grew up in California in the mid-'80s and then moved to Washington in the 90s. So she's a transplant like I am.
Yeah.
Came here with her family. And her father was a medical doctor, primary care doctor, right?
Yeah, still is.
And still is up in Bellingham. And her mom is or was a nurse?
Was a nurse in the Army. Yeah.
Okay.
And she was in school when she met my dad, who was finishing his residency. And anyway, so she didn't necessarily practice, she never had like 8 to 5 job, but she'll sub in every once in a while at my dad's office. And yeah.
Cool. So you grew up with a medical background, and then she's also number 3 in a row of 6 kids. So she has been around older and younger siblings and grown up with a large family. And she got involved in, kind of by accident, she says, through midwifery. Her sister was having a baby and was choosing a midwife, and she got interested in birth and babies and midwifery through that. So welcome, Allie. That was kind of a quick synopsis of who you are. I know you're so much more. And for those of you who don't know, Allie probably still is and definitely was an amazing pole vaulter in high school. So I actually knew her back in high school because my husband coaches pole vaulting. So yeah, when I heard you were a midwife, I was like, wow, that's awesome. Allie,
yeah, I know.
So let's get into it. Is there anything you wanted to add that I didn't tell people about you? Something you want to share?
No, I've been practicing primarily in Bellingham since 2013, and I've attended over 100 births for my practice, and then as a student, a couple hundred. So yeah, I think that's about it though.
And you have a couple of your own children.
I have 2 kids. Yes, I have a little boy who just turned 3 last week, and then a little girl. Oh, my son's name is Ulysses. We call him Yuli. And then I have a little girl who is 6 months old, and her name is Fiona. So
yes, she was here the other day when you came to the office, and she was totally adorable. And your kids have beautiful, curly, cute hair.
Yeah. And they both were born at home. So with a midwife, yes, I hired a midwife. I get that question a lot: did you have a midwife? Yeah. It's the safest is to have another midwife there because I'm also a woman and I also have to go through childbirth, and it still hurts all the same. So
I even get the same question: do you adjust yourself? I'm like, no, I have a chiropractor that adjusts me. I can't adjust myself. So
yeah, I know. Yeah, it kind of go against everything we stand for.
Exactly.
Yeah.
So you get the question, I'm sure, just like, what is a midwife? If you had to tell somebody what a midwife is, how do you explain that to people?
Midwife is a provider who offers out-of-hospital birth at a freestanding birth center or at home. And we follow the same schedule as an OB. We can run the same tests as a doctor. and we can order ultrasounds. We don't have ultrasound in our office, but I think that's for the better. I think ultrasound is a great tool, but doesn't need to be used in excess, but can be used appropriately for routine, 20-week anatomy ultrasound. That's the one where everyone finds out what baby is, boy or girl, but also early ultrasound for dating. And yeah, we can provide care to low risk women who are healthy and are really desiring this option of being outside the hospital, primarily because they don't fear birth, but they see it as a normal process that their body, if kind of left alone, can do. So yeah, that's what we do.
And there are midwives who do work in hospital settings as well, in some hospitals, right?
Yeah, there's nurse midwives. Those really are the only midwives that work in the hospital. There's CNMs, certified nurse midwives, and then there's us, licensed midwives, LMs. Most of us also have this CPM at the end of our name, which is certified professional midwife, and that's through the the national organization. So, and then there's nurse practitioners who are also LMs, licensed midwives. So they have a slightly wider scope where they can prescribe medication, but they, as far as midwives go, they're similar to us. They don't work in the hospital. Yeah. And then there's one other kind, which is a naturopathic doctor licensed midwife. And so they work outside the hospital, but they're also naturopathic doctors, which is nice. So they can prescribe and just have a larger scope of care. So yeah, there's a lot of different variations, but I think that's good. And it just goes to show that the profession's really growing.
And I think that is somewhat confusing for people sometimes, all the different types of midwives and what they all mean. So thank you for explaining the different types. And you also have on your credentials an MSM. Yeah. What does that stand for?
Yeah, good question. So that's stands for Masters in the Science of Midwifery, and that is from my Bastyr program. It is a 3-year master's program that they, I think I was the second class to actually graduate with that credential. And so we had to basically do a thesis and write a long paper, and I don't think it necessarily made me a better midwife, but I do see that our world kind of recognizes these titles and can, like, for example, I'm able to get on more insurance companies or contract with more insurance companies because of that master's. And then I also do agree that anything that can move the profession of midwifery forward, it doesn't hurt. But it's just a little more expensive and
a little more time, a little more effort, a little more expense, but also hopefully some increased knowledge with it as well. And
it was a very thorough program, and I would, anyone that asked me if I'd recommend it, I would over and over again. Bastyr.
So I had someone recently on who was a male doula. And there's just there's like a handful of male doulas in the state, and he is wanting to pursue a midwifery career. So he wanted me to ask you, what do you think of men in the profession?
Yeah. There has been, as far as I know, one male that was at Bastyr and is a naturopathic doctor. And then he also became a licensed midwife. He's amazing. And we all look to him for information and refer to him. And he's down in Seattle, so I haven't personally worked with him, but I see him at conferences, and he actually did help me with my thesis. So yeah, he's great. And I know that in Canada too, there's more male midwives in their programs. So it's definitely an option, and I don't see why not. Yeah. And I know that the male midwife that works in Seattle, he's busy, as busy as he wants to be. So,
I think that's great. And I think someone said or mentioned before, I heard we have all these male OBGYNs and don't think twice about it. But sometimes, like when they think like, oh, a male midwife, and maybe it's just the name midwife that kind of makes people think twice about it. Like, what do we call them? Do we call them mid-husbands, mid-misters?
That's true. That is a common question I get. Are there male midwives, and what do they go by? And he goes by midwife. He does. But it is true. It is like, just even 20 years ago, majority were men. And now it's definitely shifted where most of my clients, if they have to transfer care, a lot of them would rather, see a female. And it's just amazing that they have that option. That seems like, from my little, experience of OBs up in Bellingham, that majority are female now. So I think that's great that there's at least an option for women who prefer to have a female provider, whether that's midwife or nurse midwife or OB. So,
options are always great. So options in birth are always great. And options in providers are always great. And not everyone's going to mesh with one provider or another. So having lots of options is great, which is why I love having more and more midwives in the area as well. Still, I think, underserved because still such a small population of people are using midwifery care, especially out of hospital midwifery care. Do you know what the statistic is on that now? The last I heard, it was only about 2% out of hospital births.
Yeah, well, actually, recently I got an email from Department of Health. It's about hearing devices, but they mentioned that in 2015, I don't think I have it. I think that it worked out to about 3%, a little over 3% of women in Washington State were using midwives. So that's cool. I mean, I remember in school, it was like 1% was the going statistic. And what's hard is every state is different, but Washington is definitely on the forefront of, I feel like it's a little more normal to have a midwife, especially up in this corner. And I forget that, I feel like it's really common to say, oh, who was your midwife? Or, oh, I had a home birth, and it's really accepted. And and then there's, if you went to Eastern Washington, I think you'd be looked at like you've got 3 eyes or something. Like, what? You had your baby at home? And then there's some states in the U.S. that it's still not legal to be a midwife or to have an out of hospital birth, I guess. I mean, there's a lot of illegal is the term, meaning it's not illegal, but it's not legal. And so there's midwives who are practicing, but kind of under the radar or without as much support that we have here. So, So
I did have somebody had a question, and she asked, who would you consider high risk? And do you work with anyone who is considered to be high risk?
That's a great question. There's a lot of answers to that because there's a lot of different factors that could make a mom high risk. That's why we do all the routine tests and blood work and ultrasounds to make sure a mom is staying low risk throughout the pregnancy. The good news is that most of my clients, we can find a middle ground where if we do this test and I consult with an OB, then they can stay in my care. But sometimes it becomes really clear that, and a mom can start totally healthy in my pregnancy, and then something develops like hypertension, or her blood pressure for whatever reason just starts to climb and climb and climb, or something called preeclampsia, where the body becomes allergic to the pregnancy. We don't even know why it happens, or there are some risk factors, but a lot of times it's just a really healthy, normal mom, and all of a sudden her body starts showing signs of stress. And so usually it's not a sudden like, oh, that's it, you're high risk, you need to go to an OB. Usually it's, okay, this is what I'm seeing. I feel like midwives are trained in what I call pink flags. So seeing these flags before they turn red and doing something about it, trying to be preventative and proactive, and consult with doctors, try herbs, try homeopathics, chiropractic, acupuncture, anything to naturally help a mom's body get through it before having to just jump to, okay, you have to be in the hospital now. I know that's a big, fear a lot of my clients have going into the pregnancy. I think they realize as they read more and more, wow, it's a big process and I don't have a whole lot of control. A lot could happen. But as midwives, we really try, we're there for our clients in a really personal way where we really try to make it happen for them, as long as it's safe.
Yeah.
Go ahead.
What about, she was saying too, specifically who has previously lost a baby at 20 weeks. So is there things that have happened in previous pregnancies that then kind of make women have to opt out of midwifery care, I guess?
Yeah. So when you meet with a midwife, we do a detailed medical history. And so something like that would come up and we'd want to know more about, was there a reason? Did they ever have, a cause and get records and read through them and maybe consult with the provider who helped them last time. But a lot of, I guess each pregnancy is different. So as much as we say, oh, this is what happened last time, it doesn't mean it's going to happen again or that you are really at increased risk. Just because we can't do a whole lot of studies on pregnant women, it's just not ethical to say, okay, we're going to expose you to this and see what happens. And then no one's going to sign up for that. So I think it's really case by case, but I would rather women, instead of just saying, oh no, I'm too high risk, or even just taking, a doctor's word for it of, if along their care, someone said, oh, you're high risk. I feel like women just take that for truth and they don't explore their options because of that. Yet, like I'm saying, every pregnancy is different and they could, lifestyle changes. If they didn't eat well the first time and this time they understand diet, exercise, prenatals and low stress. And, there's so many factors that affect a pregnancy. So I feel like most of the midwives are willing to at least meet and feel it out and just see if it's possible, because we all just feel in our hearts we want to help women, and if it's what they really want, we want to help them get there as far as the out-of-hospital birth option. So, yeah.
So then we get a lot of questions about the safety, which you've kind of talked a little bit about, but how safe is midwifery care? How safe is out-of-hospital birth?
Yeah, well, birth it's unpredictable, and there's always risks. But most of the time the benefits outweigh the risks. And as midwives, we really know what those risks are, and we really go out on a limb to offer these options to women because we believe in it. If we didn't believe in it, if we didn't believe it was safe and it was a good option, then we wouldn't be doing it. So I think it's safe because we build a really good relationship with our clients. We spend a lot of time with them. We really get to know them. And so if an emergency does happen, I always tell people, there's this switch where I turn into pretty bossy, pretty direct. Okay, this is what we're doing. And I want you to trust me with this. And I think that that's what makes it safe. Because whereas like in the hospital, a lot of times you don't meet your provider until they're walking in the door and they're going to deliver your baby. And I feel like that can feel really unsafe to moms and dads when this provider is saying, okay, this is an emergency. Okay, we need to do a C-section. By the way, I just met you and you are expected to put your life and your baby's life in their hands immediately. So I feel like that's a huge part of midwifery care is the relationship you build with your provider, and that it's usually one-on-one. There are some practices where there's 3 or 4 midwives, but even then you get to meet each midwife a handful of times before you deliver. And, I just feel like like I was saying, we're trained a lot in trying to prevent or foresee what might what might present itself before it actually happens. You know, I had one mom once say, "I was like, oh, you were like a Jedi. You knew what was going to happen like 3 steps before it happened." And that was I was like, thank you. That means a lot to me, because I feel like a lot of the training is looking at the big picture and trying to really predict where is this going, and then also informing our clients, like, this is what we're seeing, and here's your options, and you make an informed choice, and I'll help guide you, but ultimately it's your choice. And that can be really empowering. Though I know some people, they want a provider who's going to tell them what to do. And that gets hard, because that's not the type of client that really does well with midwifery care. Because we really want to see you grow and make those choices and read and inform yourself.
Do you think that comes from fear, from a place of fear for some of those women?
Yeah, and just how medicine is set up. It's a lot of power dynamic of, provider knows what's best, and this is what you should do, even if your instincts are saying no, that doesn't work for my body. But I know most of us growing up, that's the dynamic we're used to. You go to the doctor, you do what they say, you take the medicine, and kind of no questions asked. So, yeah.
That's a lot, just even in our education system, that happens too. And in our medical system, we're told what to do. And I think people are starting to question things a lot more, which is great for midwifery, and it's great for chiropractic. It's great for more natural healthcare methods, because it makes sense. And once people become empowered and part of their own decision-making process, then these things make sense to them. And they know that they can trust us in saying when they need more interventions or to go a different route, because we're trained to find those, like you said, the pink flags before things become the red flags. I love that term. Yeah. So, but so many people are still fearful, I think, of their body and what it can do. And I feel like, and that's, if a mom, I think it's normal if a mom's pregnant and is a little scared of, okay, now I have to birth this baby. But at least we've got 9 months to really work with that fear and change that fear, at least figure out where is that fear coming from. And can we fill that fear with knowledge? And, that's where reading and childbirth education and just processing, writing a birth plan, not necessarily because birth is going to go how you plan it, but at least you are sitting down and figuring out what's important to you. I think that, like I said, we haven't been taught to think that way when it comes to medicine. What do I want out of this? So it's a really great journey. It's amazing to do it with families over and over and just see, and not just the women, but their partners too. I feel like that is so fun to see the partner really. I think it's easy for them to be very fearful in the labor. They're not going through it. Whereas the moms are getting all the hormones and the adrenaline and they're feeling it and they're doing it. And that feedback loop is positive because they know what's happening. They feel baby moving down. Even if they're being really loud and crawling around, or, what other people would say, they look like they're going crazy, but they're having a baby and they're doing what they need to have it. And for partners, that can be really hard to just sit there and watch. And to be able to feel that fear in that moment with, she's doing so good. Look how strong she is. Wow, she's amazing. And just see them like their eyes just change. Instead of this fear, they're like, you're right. Wow. And just this newfound love for their partner and amazement. And then when their baby's born, just this just the tears and the that was so amazing and empowering for them too. Not fear-based. That's
that's what, when I see that, that's kind of what keeps me going. So.
Yeah. And I think there's, some husbands, I always tell people that they should really get a doula, especially if they're going to be in a hospital setting. I think doulas are very important, but for home births and birth center births as well, just to have that extra support person that's been there through their pregnancy. And I would say most of the time it's the dads who come up to me afterwards and say, thank you so much for like making us or pushing us towards getting a doula, because it made a world of difference. And I see midwives like yourself fill that role and do that as well for dads, because it can be scary for them. Yeah. Like you said, they've never been through it before. And how many dads have actually witnessed a birth of any kind before they actually are witnessing the birth of their own baby with the woman that they love? Yeah. So, even women, how many women have witnessed a birth? We just don't see that anymore.
Yeah. No, I cannot stress the importance of a doula, especially with your first, because you really don't know what's going to happen, and they tend to be longer labors. And if you have to transfer to the hospital, that's a huge change, and a doula can just help smooth that out. Midwives do transfer with their patients to the hospital, but we'll stay, as long as, everyone has their own, I guess I shouldn't speak for all the midwives, but at least stay till the client is settled and in good hands. But a doula can stay for the whole thing and really advocate and, remind the providers of the little details like delayed cord clamping and skin to skin, or even just watch the partner and say, hey, when was the last time you slept? When was the last time you ate? Why don't you go take a nap while I do the hip squeeze, like squeeze their hips? Because some moms, they need hip squeeze through the entire birth. And 20 hours later, if that's just, one partner doing that for the mom, that's...
That should work out for the mom.
And then by the time it's actually, exciting time is here, and the mom starts pushing, the baby's born, and it's like everyone's just so tired. And doulas, I had a doula for my first, and she was my husband, even though he knew a lot about midwifery care. We met and got married while I was in school. He knows probably way more terms than he should. He when I was in labor, he broke down too and started crying. And that was a point of, I said, no, you can't cry. You have to be strong for me. And that's when our doula stepped in, and she helped him kind of recompose himself. And at the end of it all, he was like, she was worth her weight in gold. I cannot imagine doing it without her. And so, we had her again for a second. And yes, I really can't stress it enough.
Don't forget, if you want to try to have a shorter first-time labor, chiropractic care is very important. Joan Fallon did a study showing that if women were under chiropractic care for their pregnancies, for first baby, it was about 24% reduction in time for labor for those. So, and then more so for second and third babies in reduction in time.
Yes, getting that last adjustment to make sure everything's in alignment. And that is the one thing, baby's position in labor can be so hard. You can't reach in there and turn them but what I found is, adjusting women towards the end, making sure those ligaments in the pelvis is nice and open so the baby can find its way easier, has been really valuable. Yeah.
And even now, so many people are out of balance before they even get pregnant. To even have care early on, even before pregnancy, is great, and throughout their pregnancy. So you're not making huge changes at the end. So you're making those changes to have optimum function and balance when you go in to have that baby is awesome. So I think I love working with doulas and midwives because we all have the same vision for the patient or the mom, the family, and we really want to help them have a beautiful experience.
Yeah, that's true.
So is there anything else you wanted to share before we say goodbye for today?
No, I don't think so. I don't think so. Any more questions? I don't see any popping up.
I don't see any popping up right now. I think that's all we have for today. But if anybody has any questions after, or watches this afterwards, or listens to it afterwards, you can always send us a message in the comments, and Allie or I will respond to them. I'll make sure that we get them answered for you. And you can always reach her. She's at Haven Midwifery. Her office is up in Bellingham, although she lives down here in Burlington now. So she's a Skagitonian as well. So we'd be more than happy to answer your questions. I had 4 home births for the same midwife. Winnie McNamara is my midwife. She's been around for years. She's great. I love her. I know people who have more than babies than they think they're going to have, just to have Winnie as their midwife again. So.
Yes.
I'd be happy to tell you about my experiences and share my stories and help you out as well. So thank you, Allie, for coming and sharing about midwifery care and telling everybody about it, because I think more people need to know that this is an option, and need to know how well trained and prepared that midwives are, and that it's a safe option for a lot of moms out there. Yes, definitely. So we will say goodbye for today, and thanks a lot, and keep in touch. And again, any other questions, make sure you let us know. All right, thanks. Bye. Bye.